Let's look at our primary producers as one category. And the primary producers would be the doctors and the hygienists. Now, let's talk about the acronym I like for this one, and we'll call it FCTD. Starting with face-to-face, obviously building that relationship, it's so important for a patient walking into an operatory to form that relationship. If it's a first impression, absolutely critical in what you do in getting that patient comfortable, or forming your ongoing relationship, continually hitting those touch points that you've established in the past. This is with backstage support. You have to be aware of what you talked about before, critical to have your personal notes. But forming that face-to-face relationship is very, very key with any primary producer. They're looking at you as the person who's primarily going to be in their mouth. Huge. Face-to-face. Next one is comfort. It marries through with face-to-face. We have to make them comfortable. We have to make them comfortable in terms of psychologically, and that's why it marries so beautifully with face-to-face. So the comfort that the patient has is the comfort that comes from the trust. It's the comfort that comes from the fact that they believe you are going to be in touch with them and communicate properly, so they trust you ongoing. Not just initially meeting your customer, your patient, renewing that relationship once again with the long-term patient, but they have to be comfortable so they know that you're going to communicate ongoing with them. That's part of the comfort. The other side, the flip side of comfort, obviously is what you do procedurally. You can't hurt the patient. In this day and age, you have to learn how to make the patient comfortable. That comes from communication, to anticipate what they might be thinking, what they might be feeling, in terms of techniques and how you give injections, that how you discuss with the patient what they're going to feel, what they're going to hear. We go into this in great detail with some of our live presentations, but the comfort can never, ever be overlooked. Now, hygienists are in a very somewhat more difficult role when it comes to comfort than the dentist. Hygienists are sitting there, they're doing things which are mechanically manipulating surfaces of teeth. This is uncomfortable. So we need to be very, very aware in understanding what they're feeling ongoing. If you hurt the patient, regardless of what you think you want to do in terms of doing your job in your treatment, the comfort trumps everything. Because if you do the most amazing treatment on a patient, they aren't coming back if you hurt them. Bottom line, they aren't coming back. They may not tell you, but they will just go away. So if you aren't addressing their comfort, then you're not going to be able to keep them as a patient to get the care they need. They might get it in one visit, but that's the only time they'll get it. They will not return to you. So comfort, FC. The next one we talk about is TD, treatment. We have to obviously know how to provide treatment. And this is obviously something we're not going to go into in depth here, but treatment is what we do. It's what we do every day, and there's ways to do this. There's ways to learn to do it efficiently, comfortably, communication-wise with the patient and what you're doing. They have to understand what you're doing, why they want it done, and they will happily then accept what you're doing. And the next one with that is obviously diagnosis. Diagnosis is the craft of what we do. It's bringing a patient in. It's taking that very confusing situation that a patient has in their mind about what's going on, anticipating what you're going to tell them, and being able to carefully diagnose it in terms that they can understand, which obviously leads to the treatment. So diagnosis can't be overlooked. Diagnosis has to be done in terms of two ways. What you know as the professional, what you know as the practitioner that needs to be diagnosed, and then how you translate that diagnosis in language the patient can understand to the patient. Telling a patient they need a soft tissue graft because they have recessed gums and unattached gingiva means nothing to a patient. It's got to be done in terms of things that they can understand, which I won't go into here. But in other words, the diagnosis then has to translate then again into discussion and communication. So it comes right back again to face-to-face. How are you able to communicate with that patient face-to-face? They're interrelated, but I think those four categories capture it all. So what would I say to a mentor? I mean, what would I say when I'm mentoring a new associate? Go and get back always again, I'm bringing a new dentist in, and I would say to that dentist, number one, you have to form a relationship with every patient through their eyes. Number two, what you need to do is at all levels, the patient has to be comfortable. They have to be comfortable in terms of trust. They have to be comfortable in terms of reducing as much as you can any pain that they would have. They've got to be then comfortable with what you're actually doing in the treatment, what you're doing in that theater. They have to know, they have to feel comfortable in what they're doing. And the last thing is they have to be comfortable that the diagnosing you're giving to them, they understand, but most important, they know that you understand. That's what we do.